September is Heart Awareness Month, so be kind to your heart. Regular health checks are essential to knowing your numbers. Clicks, through the Helping Hand Trust, is offering free blood pressure tests and cholesterol screenings to anybody without a medical aid during the month of September. Why is it good for me to get regular blood pressure tests?
Well, often blood pressure is not, doesn't have any symptoms until it's severe. Regular checks are essential to detect early warning signs. Also, you need to regulate your salt intake, as high salt diet is a driver for high blood pressure.
I love salt.
Very bad for you. Very, very bad for you in excess, and it causes high blood pressure.
And what is considered a good blood pressure reading?
A good blood pressure reading is between 110/60 to 130/80, but can fluctuate.
What's my reading?
110/60.
What does that say about me?
That's an ideal blood pressure. Yay! So you're good with the salt for now?
Okay, good. Maybe I'm not taking that much salt.
Good, keep it that way.
I've recently learned that there's good cholesterol and bad cholesterol. What's the difference between the two?
Your good cholesterol is your HDL, which carries hormones and repairs damaged blood cells, and then removes your excess LDL, which is bad cholesterol. Your bad cholesterol, if it's in excess, narrows the arteries and causes strokes and heart attacks.
So this is the one where you actually prick my finger?
Absolutely. Don't cry. Okay. It's a simple procedure, it's quick and easy.
And what's considered a healthy cholesterol reading?
A healthy reading is considered between 3 and 5 millimoles.
So mine's come out as 4.5.
4.5 is an excellent cholesterol, which means you're in perfect health.
That's so perfect.
Yes.
Yay.
Yay.
Well, it looks like I'm in pretty good shape. Don't forget that if you don't have a medical aid for the month of September, you can visit any of the 190 Clicks clinics for a free blood pressure test or a cholesterol test to keep your heart beating strong.
Now, regular dentist visits do a lot more than just keep your smile beautiful. In fact, they also ensure that your teeth and gums are kept clean and healthy to avoid any health implications. We have Dr Nosipho Mzobe, Head of Education at the South African Dental Association, in the loft with us to discuss small changes that can improve your oral and general health. Welcome to Afternoon Express.
Thank you, Jeannie. Thank you, Bonnie.
Yeah, lovely to have you. So what is the connection between dental health and general health? Because just when I thought my dentist issues couldn't get any bigger, now I hear it's connected to heart health.
At least you've got good cholesterol.
Yeah, at least.
There is a link between dental health and your general health. For an example, if you sometimes have an infection in your mouth, it could be linked to a systemic condition, and vice versa. Some dental infections have been found through research to actually cause as well as propagate systemic illnesses. An example of which would be periodontitis, which is linked to cardiovascular disease.
And is it true, like, if you there's something else wrong with you, you'll find out about it because your breath will smell bad?
Yes.
Is that true?
My gosh.
Okay. So apparently if you're sick, like with guttural infections and things like that, you can tell because your breath smells.
Oh.
Okay, so what can we do at home to ensure that our gums and teeth are healthy? Because gum health is just as important as teeth health.
Yeah.
No, that's true.
Okay.
There are several things that you can do. Most importantly is going to your dentist and your oral hygienist at least twice a year. Your dentist will then come up with a treatment plan that is specific and unique to you.
Probably painful.
No, not painful. I'm telling you, it's so important to have your teeth cleaned by a dentist.
No, I know.
My dentist is so good looking. I love going to see him.
I'm sure.
We actually take the pain away. We don't induce the pain.
Okay.
Yeah. So basically, the other thing that you can do is brushing your teeth. And by doing that, you're starting the maintenance therapy at home. And brushing and flossing of your teeth is very important.
Yeah.
Okay. Brushing at least twice a day and flossing at least once a day. And when I say brushing of teeth, I mean brushing of the teeth and the tongue. It's also important that when you're eating, having a meal, after you've had a meal, to drink a glass of water, basically to flush the teeth, removing food that's stuck between the teeth, and also to chew sugar-free
gum.
This helps stimulate saliva. Saliva is very important.
Yeah,
It helps to lubricate the teeth. Basically, you eat better, you swallow better with saliva, but with saliva being there. And also, it has buffers in it. And these buffers help to maintain the integrity of the tooth.
Okay.
Wow.
Let's discuss brushing though, because I'm an overbrusher.
Yeah. You brush
you gonna
hard.
ask?
I was going to ask, what's better, electrical toothbrushes or, you know,
Oh, yeah,
old
normal
school?
manual.
Yeah.
Okay, luckily I've got an example of both. This would be your manual toothbrush, and this is the one that you basically operate. The pressure and everything that's applied to the tooth is determined by you.
By you.
Then the electric toothbrush, of which there's several on the market, there's several types on the market, has been found by research to effectively remove plaque and thus reduce the likelihood of you getting gingivitis.
So this is the best one to go for.
the best
Which one
one.
do you use, manual or?
Well, I use an electrical, but my kiddies still use the gewone one because imagine my two boys both with electrical toothbrushes in the bathroom at the same time. Something is going to end badly.
I just don't have the discipline to keep this thing charged. That's why I use that's why I go old school.
Basically, effectively, that one would be better.
Okay, so this
At
is going to
cleaning
give
your
me better
teeth.
teeth.
Yes.
And then how often do you have to change your toothbrush?
Okay, a lot of us forget,
Yeah.
but you need to change your toothbrush at least every 3 months.
Oh, really?
Yeah.
Okay.
Wow, wow. Sure, I've
Good
just
to know.
got to get going to the dentist
Keep this on
sometime
with me.
soon.
One's mine.
The sooner the better.
Now, during Oral Health Month, Clicks teamed up with the Helping Hand Trust to ensure that for every Clicks branded oral care item bought during the month of September, R1 was given to the Smile Foundation. Thanks to the campaign last year, 6 children were able to receive free corrective facial surgery treatments. I'm obsessed with the Smile Foundation.
Sure, they're doing such incredible work. I also want you guys to head over to our Facebook page and to give us a call. The number you can dial is 083 913 3728. If you have any questions when it comes to your dental health, make sure you call us live on the show. We'd love to hear from you and get all your questions answered. And if you've forgotten that number, head to our Facebook page. And while you're there, don't forget to like us. We want to reach that 50,000 likes as soon as possible. 083 913 3728 with your dental health questions. After the break, right here on Afternoon Express, we're going to be smashing some burgers. Don't go anywhere.